Hello everyone, this is me Dr. Manish Kharel and I will be discussing the pathology section with you guys. So today I will be starting with the general pathology part and the topic of our discussion is injury. As we know, this topic is a very simple topic, but yet it is a very important topic in our preparation. So regarding cell injury, what is a cell injury? As we know that a person gets injured, breaks his bones and legs, and similarly in the same way cells also gets injured and its constituents, its organelles gets damaged, leading to different consequences. So basically what causes cellular injury is different stress and stimuli, noxious stimuli that gets the cell to get damaged. So today we will be discussing about the cell injury and its types. So okay, now before discussing the cellular injury and its pattern, there are some responses which the cell shows to different type of stimuli, and basically due to the stress and injurious stimuli, due to the stress, cell undergoes cellular adaptation, and we will be discussing about this cellular adaptation in the next time, but today we will be discussing more about the cellular injury. So when the injurious stimulus gets upon the cell, then the cell injury goes to two pathways. One is the reversible one and another one is the irreversible. When the cell injury goes to the reversible pathway, it is mild and transient, and after the withdrawal of the such stressful stimuli, then it can again revert back to the normal cell. Whereas in case of the irreversible injury, it is the severe and progressive one. So basically the irreversible injuries is of two types. One is necrosis and another one is apoptosis. So in such cases the cell cannot get revert back to its original normal state, so finally leading to the cell death. So let's discuss about the standard definition of cellular injury. So what does it say? That if the limits of the adaptive responses are exceeded, or if the cells are exposed to damaging insults. So whenever a cell gets stressed, then it undergoes some cellular adaptation, but if these threshold of adaptive response are also exceeded, then the cells can get injured, or if the cells are exposed to damaging insults like different toxins, chemicals and drugs, or maybe they are deprived of critical nutrients, as the cell needs these nutrients for the survival, or different types of mutations also are there which affect the cellular function. So as a result of all these things, a sequence of events follows, and this is known as a cellular injury. So moving on to the causes of cellular injury, there are different causes of cellular injury, and among them some of the important ones I will be discussing with you guys. The first one is oxygen deprivation. Oxygen deprivation is basically the lack of oxygen to the cells and tissues, and it is under the two main subheadings, hypoxia and ischemia. Hypoxia basically refers to the lack of oxygen to the tissue, whereas ischemia is the loss of blood supply to the tissue, which ultimately results in the compromisation of the oxygen. So another one is the physical agents like different mechanical traumas and extremes of temperature, that is extreme high heat or extreme cold temperature can also cause the cellular injury, as well as radiation also does the same thing. And there are different chemicals and agents and drugs that cause cellular injury, like arsenic, mercuric salts, and insecticides, carbon monoxide, as well as alcohol causes cellular injury. As we know that the alcohol leads to the damage to the liver, which ultimately is the damaging of the cells of the liver, which are the hepatocytes. So there are different infectious agents like viruses, bacteria, fungi and parasites, which also result in cellular injury, and some immunological reaction like anaphylactic reaction to foreign bodies, as well as some autoimmune diseases like SLE, rheumatoid arthritis. These are the most common ones, so I am mentioning here. In such disease also cellular injury occurs, and some genetic errors like Down syndrome, sickle cell anemia causes cellular injury. And sometimes the nutritional imbalance in our body, like protein calorie deficiency, vitamin deficiency, as well as nutritional excess,